Hello everyone. I am myself Dr. Rajesh Gubba. I am the General Medicine Educator. In this session, I'll be discussing the quiz which I have posted on 23rd of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So every day I'm posting the quiz on my Telegram channel, and on the subsequent day I'm sending the discussion as well. So as a part of it, the first question is, which of the following drug is used in the treatment of subacute sclerosing panencephalitis? The options are acyclovir, mirtazapine, isoprinosine, foscarnet. The answer here is the isoprinosine. So this isoprinosine, it should be given along with the interferon alpha. Whenever you give isoprinosine along with the interferon alpha, this will prolong the survival of the individuals with subacute sclerosing panencephalitis. Now what about the other options? The acyclovir, it is not given for, if you take the subacute sclerosing panencephalitis, it is the one which is caused by the wild measles virus. And acyclovir, it is not effective against the wild measles virus. And what about this mirtazapine? This mirtazapine, it is used in progressive multifocal leukoencephalopathy, but not in case of subacute sclerosing panencephalitis. And foscarnet, if you see, it is a drug which is used in the it is also an antiviral drug used in the treatment of cytomegalovirus and cytomegalovirus associated ophthalmic retinitis in individuals diagnosed with the HIV. So this is about the treatment for the subacute sclerosing panencephalitis. So if you see the quick discussion of subacute sclerosing panencephalitis, right? So the another name for this SSPE is, it is also called as the Dawson's disease. And what exactly happens here is encephalitis, that is brain inflammation, which is caused by the measles virus. And what is the age group at which you see this SSPE is? You come across this in children, teens, and as well as the young adults. And as such, there is no cure for subacute sclerosing panencephalitis, right? And always the prognosis is fatal. And this subacute sclerosing panencephalitis, it should not be confused with acute disseminated encephalomyelitis, because even this acute disseminated encephalomyelitis, it is also caused by measles virus, but this acute disseminated encephalomyelitis, it has a very different timing and as well as the different course as well. So that is about acute disseminated encephalomyelitis. Now coming to the second question, which of the following is false about the progressive multifocal leukoencephalopathy? Occurs in natalizumab treated multiple sclerosis patients. It is due to JC virus infection. Isoprinosine prolongs the survival. Homonymous hemianopia is the most common clinical feature. Now, in case of the progressive multifocal leukoencephalopathy, yes, it occurs in natalizumab treated multiple sclerosis patients. And it is due to JC virus infection, and isoprinosine prolongs the survival. That is the false statement. So what is the drug which will prolong the survival of progressive multifocal leukoencephalopathy is? It is mirtazapine. That is the one which will prolong the survival in case of progressive multifocal leukoencephalopathy. And homonymous hemianopia, that is the most common clinical feature in patients with progressive multifocal leukoencephalopathy. So that is about your PMLE. Then next question, if you see, which of the following is not the manifestation of subacute sclerosing panencephalitis? Options are fever, poor school performance, focal or generalized or myoclonic seizures, visual disturbances. Remember, in case of a subacute sclerosing panencephalitis, the fever, it is not at all a feature, or it is a rare manifestation in subacute sclerosing panencephalitis. The remaining all can be seen in patients with the SSPE. So if you take this SSPE, we have totally 4 stages in SSPE manifestations. In stage 1, stage 1, it will last for nearly around 6 months, and the presentation is usually in the form of mood swings or depression. Whereas stage 2, it is the one which is characterized by jerky movements, muscle spasms, seizures, and there can be even loss of vision as well. Whereas stage 3 is that where the individual will have jerking movements which are replaced by the writhing, twisting movements and as well as the rigidity. That is what you will see in stage 3. Whereas in stage 2, you get that jerky movements. Stage 4 is that where there is progressive loss of consciousness into a persistent vegetative state. That is what is your stage 4. And finally, how does the death occurs? Death usually occurs as a result of fever and as well as the heart failure. So that is about the progression or the manifestation in patients with subacute sclerosing panencephalitis. Then followed by that, the last question is, most common parasitic disease of the CNS infection worldwide is neurocysticercosis, toxoplasmosis, schistosomiasis, the amoebiasis. The answer here is the neurocysticercosis. That is the most common parasitic infection which is affecting the CNS worldwide. And if you take this neurocysticercosis, it is mainly the location of the cysticerci. That is a very, very important area of the question. Now, what is the most common site of the cysticerci of the neurocysticercosis, or where is that space occupying lesion? Very commonly is, most commonly it is present within the brain parenchyma. Followed by that, the location of the cysticerci will be in the intraventricular area, followed by that in the subarachnoid space, followed by that the spinal cord, and finally the orbital area. So this will be the localization of the cysticerci in case of the neurocysticercosis. Now, because the most common site is within the brain parenchyma, what will be the most common manifestation? The most common manifestation will be in the form of the epilepsy, right? And the other manifestations will be in the form of the focal neurological deficit. So that will be the manifestations because of the presence of the cyst within the brain parenchyma. And when the cyst is present within the intraventricular area, that will cause the obstruction of the CSF flow, and that will result in the hydrocephalus. And if the cyst is present within the subarachnoid space, right, the individual can develop meningitis, and that we call it as the basal meningitis. And if it is present within the spinal cord, it will cause the spinal cord compression. And how will be the imaging in patients with neurocysticercosis? So you have the presence of multiple, right? You have the presence of multiple intracranial space occupying lesions in patients with the neurocysticercosis. And how do you treat these patients with the neurocysticercosis is, drug of choice will be albendazole, right? Drug of choice will be albendazole. And we also have an alternative drug. The alternative will be praziquantel, right? The alternative will be praziquantel, but the drug of choice will be the albendazole. And for this epilepsy, you need to give the anti-epileptic drugs. And in the acute phase of the neurocysticercosis, you also need to give corticosteroids. That will be the treatment for neurocysticercosis. So this completes the discussion of the quiz which I have posted on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, on 23rd of May. So thank you very much. See you tomorrow again.